There we are. It says live. It does say live. Okay, everybody. It's Dr. Linda of the Vascular Birthmarks Foundation coming live from Baltimore, Maryland with Dr. Buddy Cohen, Dr. Bernard Cohen, 30 years experience at Johns Hopkins, VBF expert, past president, Society for Pediatric Dermatology. And today's topic is all things pediatric VBARs, so all things vascular anomalies, birthmarks, and related syndromes. I do need to log on my phone to see if you guys can see us and hear us. Otherwise, I have to log off and start all over again. So let me just take a second here. Normally, I'm a little more organized, but today's been a little tough on me. So let me see if I can see. Yes, I do see where we are live. So if you could post comments and tell me that you see us. Oh, I see there's 8 people on. So Dr. Cohen, say hello.
Hello, my pleasure. We are alive.
Yes, we are alive and we are live. And we're a little early, so it's only 2:55, but I've been having technical difficulties, and if I logged off and tried to reschedule it again, then it would just be all wonky. So I can see it shows 8 people on there. Can you, anybody who's on, let us know where you're watching from, who you are, so I can see the questions appear. Oh, sorry, let me just turn the volume down here because we don't want to hear me talking. Okay, do you see me? Do you see us? Let me know if you see us. Oh, hi, Catrice. Yes, other people are watching with you. Great. I see Port Wine Awareness is on. Great. So, hi, Chrissy. Chrissy Holland is watching us now. So we are here until 4 o'clock, and we will be taking all of your questions. Hi, Karine. Karine is from Israel. So let us all know your name and where you're from, and you can ask us. Today's session is anything in the pediatric world about VBARs. So this morning we talked about, Dr. Cohen and I talked about all the 9 primary types. So you can ask questions about port wines, hemangiomas, cutis mamarata, venous, lymphatic, AVMs, drug therapies, laser therapies. He's been, what did we say? You've been lasering for about 30 years?
I've been retired for 2, but lasering before that for 30 years, yes.
Yes, so lasering for 30 years. And he's a part of our laser guidelines group and part of our VBF international team. So I see some more people are on, looking for some questions. It usually takes a minute for everybody to get on, and they don't think we're going live until 3. So a lot of people probably have their phone set up. I can make some announcements. Like I said, I can see people who are on. But Dr. Cohen will be with myself in November in Boston at Candela Laser headquarters, where we will be working on our laser guidelines project to establish uniform standards in the treatment of all vascular birthmarks that are treated with a laser. And so he will be there with the rest of our team at the free laser clinic in November. Unfortunately, he will not be able to be with us in October in California, but he will be with us in November, so you can see him there. I know a lot of his patients have contacted me. Karine from Israel wants to know, what moisturizer do you recommend for use on a port wine stain? Because I know a lot of them say it gets scaly and dry.
Well, listen, especially, you're Israeli?
Yes.
Well, again, I might use a sunscreen. I mean, I like Aquaphor, to be honest with you. I'd use that in a lot of kids with a little eczema, but it certainly be something that you could use on a port wine stain, and it's cool because it does 2 things. It provides a barrier, and it actually puts a little bit of moisturizer, a little bit of water in the skin at the same time that provides a barrier. If you're going to be outdoors a lot, I mean, again, one of the things we've been thinking about is that, especially if it's a lesion which is exposed to the sunlight, I don't have a problem with you using a sunscreen as your moisturizer as a routine. And the sunscreens, the only sunscreen which is only sunscreen ingredients which are really approved by the FDA here, and I think with good reason, are those that contain zinc oxide and titanium dioxide. And again, if those are applied and gently massaged in, the color kind of the white color kind of disappears, and it provides, again, it can provide a very nice moisturizer. At the same time, it can provide a protective barrier,
Yeah,
especially if you're in a sunny part of the world.
yeah, and I don't know if you know this, but Aquaphor just came out with a pump spray. It's not an aerosol.
It's not an aerosol. No. It's just a convenient.
Yeah,
Yes.
yeah, and I think for babies, it could be a very good idea because you're not rubbing it after they've had laser or on a dry patch. You know, you're just kind of gently spraying.
Just gently spray. Yes.
So you might want to look for that cream. See if we get it at CVS pharmacies here. We have it. Somebody said the Target, Walmart. I am not sure what.
It will be there. It will be there.
You could probably get it on Amazon. Okay, so Chrissy Holland says, hi, Chrissy from Florida. We're heading to New York this weekend to meet with Dr. Weiner for our 4-month-old daughter's hemangioma. Would you be able to tell me what some differences are between hemangiomas and venous malformation?
Well, sure. A venous malformation, not always, but often is present at birth. And the malformations are what I call relatively stable. Now, over a period of many years, they may become increasingly prominent, but they are benign, quote-unquote, malformations, whereas infantile hemangiomas are vascular tumors. They're totally benign tumors, don't get me wrong, but they are tumors, and they go through a growth phase and a regression phase, which is very, very different from that of a vascular malformation. So, most infantile hemangiomas are going to be present within the first month or two of life, usually within the first 2 or 3 or 4 weeks of life. There may be some subtle changes early on, but they often will blossom in that first 2 or 3 weeks. They go through a period of growth where they become increasingly prominent, they become more elevated above the surface, develop more vascularity, and that typically occurs for the first, say, 3 to 4 months. So though some of them will grow as long as 6 months, and occasionally there'll be some that grow for a year or longer, but they also go through a period where they stabilize, and then they go on also to regress. Now, they don't all go away completely, but many of them will decrease significantly if we're patient over 2 or 3 or 4 years. But again, that's what a vascular tumor does in this setting of a hemangioma as compared to a venous malformation, which is a stable, non-tumorous, generally non-growing kind of lesion. It becomes more prominent because over time, I mean, you guys that probably have veins on your legs or arms, you know that those normal veins over a period of a couple of decades can become more prominent. The veins that are in venous malformations can do the same sort of thing. And it really depends to some extent where it is. If it's the higher it is above the heart, the less you have to worry about gravity making it more prominent. The more it is below the heart, the more the gravity plays a role. But the vessels that are there become more prominent over decades.
And I just wanted to add something, because if she's not saying that anyone said this, she just asked that question. We're going to see him for our 4-month-old daughter's hemangioma. What's the difference? So there must be some suspicion. So Chrissy, if you want to email me at vbfpresident@gmail.com, that's vbfpresident, all one word, @gmail.com. Let me see some pictures, because pretty much clinically we can tell these, right?
Most
Whether
of the
it's
time,
venous
absolutely.
or hemangioma, just from the history we get from you, and
from the clinical
the
presentation.
presentation.
Yeah.
Was something seen on ultrasound? If it wasn't, was it there at birth? When did it come out? Is it hot? There's a lot of little clues. Now that's only if you're going just to get the diagnosis, because that's, a lot if you're just going for a 4-month-old to get a diagnosis. If you're saying you're going for surgery, that's a different thing. But if you're just going up to find out the scoop, then, maybe we can just help you figure out what it is first, and then you can decide. That's up to you.
The image.
You may have already sent him pictures, and he said this is definitely a hemangioma. But
Well, what we'd like you to do if you're going to get images is take an image from a good distance away first, so we can get a sense of where it is, how big it is, and then get some closer up images so we can see the the fine details, and because that will help us in distinguishing a vascular malformation from a true infantile hemangioma, which is a benign vascular tumor.
And both are treatable, and they're both, Dr. Wayner's an expert in both of those. We're just, trying to explain to you to help you. So we have our next question from Cheryl T. How long roughly does the CM-AVM genetic blood test take? We have had a skin biopsy return with MAP2K1, and this took 8 months. I was hopeful this blood test might be quicker. Thank you.
Again, it varies from lab to lab.
Where she's located.
Yeah, some laboratories, if they get it, can get you a response within 2 or 3 weeks. Other laboratories may put it on hold, and it could take you, like I say, 4 to 6 months or longer. So it has a lot to do with
the lab,
who's doing it, the lab, and
the
how they get access to it, that sort of thing. Yeah.
Paige Britton wants to know, what's the difference between a port wine stain and a stork bite?
That's a good question. The term I use, and I think most people would use, and you can look this up online because it's really cool, for a stork bite is a nevus simplex. As nevus means birthmark and simplex means sort of simple. Nevus simplex is a very, very, very common vascular malformation. It is a capillary vascular malformation. It tends to be in certain places. The most common sites, for instance, would be on the midline of the back of the neck. You can certainly see it, on the midline of above the nose and the forehead. Sometimes you'll see them symmetrically over the eyelids, that sort of thing too. They tend to be relatively light in color. They tend to have fuzzy borders, and the natural history of a nevus simplex is that they do not increase in complexity. In fact, many of them over a period of several years will get much lighter or disappear completely. Whereas a port wine stain, which is also a capillary vascular malformation, so they do share that, it tends to be darker in color. It doesn't necessarily appear in nice, neat, symmetric lesions on the above the nose, on the mid-forehead, or on the back of the neck. It can appear almost anywhere. They tend to be much more prominent, and we can't always distinguish nevus simplex from port wine stains, but very often, based upon the intensity of the color and also the definition of the border, we can often distinguish, and the location, we can often distinguish a nevus simplex, which is totally innocent, self-limited, may hang out for sometimes.
But they can also be treated with a laser.
They can be treated with a laser, but they're in places where they usually don't cause trouble, and they usually get lighter, and they may not disappear, but they often do disappear or get much, much dramatically lighter, and a couple years down the road, it may not be an issue at all for your child. They also do not increase in intensity, if anything.
Do they blanch like a port wine?
Oh yeah, they blanch.
But I always thought their color was like a slight off, like it had even a tingish orange to it.
Not necessarily. They can be nice and neat. They tend to be pink instead of red. Yeah.
Yeah, pinkish. Yeah.
Pink. Well, that's just because they're lighter, and the vessels.
Right, that's
the
true.
vessels are less prominent.
Right.
There are fewer vessels. They don't extend deep in the skin, and they're often in places where they are camouflaged by eventually by hair in the areas where they appear.
Okay, Avetta has a great question. Can a lower lip hemangioma be removed with laser treatment? Our daughter is 1 year old.
Well, again, if it's something that's not growing and has never been treated medically, one of the things that I might consider doing is treating it medically with hemangiol or propranolol or something like that. Because sometimes, if it's gotten stable and not growing, sometimes it will respond to medical therapy. On the other hand, if it doesn't and it's persistent, then it certainly may be a candidate for surgical removal or interventional radiology, where they inject a medication that causes it to kind of scar down from the inside out. So again, it's the most important thing is making the diagnosis, confirming the diagnosis, looking at how it is clinically now. And again, if it truly has features of an infantile hemangioma and has never been treated, it could be treated medically before jumping to a surgical intervention. But again, if it doesn't respond well, or doesn't look like it's a good candidate for that, then surgical intervention or interventional radiology would be options to think about.
And our staff is on. They just posted my email, so they can also post yours. We have Dr. Cohen's email. You can send him pictures, and he'll give you an opinion. And you can like just kind of help them sort it out. Avetta wants to know. Oh, that was the same one with the laser. But basically, the best time to use a laser on a lip hemangioma is just when it's coming out or when it's done and you want to clean it up. But if there's any bulk to that, the laser...
It may not respond as well.
Yeah, right.
Yeah.
Okay.
Well, there's some lasers that do pick up deeper vessels, and maybe a
You mean like a
potential.
YAG?
NDI, yes.
Yeah, I've heard some people have tried it.
Yeah, sometimes it works.
But send a picture, because a picture's worth 1,000 words,
And
right?
even send to the
Really is.
VBF, and then we can get a look at it with the VBF.
Oh, so Avetta said it has been treated with propranolol, the lip hemangioma, so she's probably just trying to figure out how the rest of it can be removed, and if she actually has to undergo surgery, or can a laser work? But again, you'd have to see it.
You have to see it.
Because you have to be careful too with that, with laser on the vermilion, the lipstick line, because if it's a girl, you don't want to hypopigment the lips, so
Right. You have to be
surgery
careful.
maybe, you just have to take a look and get all the facts and then make your best decision. My daughter has a port wine on 2/3 of one side of her face. The port wine on her forehead was almost gone for a while. Then we didn't treat because of COVID. This is from Israel. All of a sudden, the birthmark seemed to creep back. It literally started going up like filling a glass of water. It went up every few weeks. We don't exactly remember the progression until it was back. Have you seen a redarkening that happens like this? With treatment, can the results be good as they were before?
No, the answer is that certainly it would be reasonable to restart laser therapy. One of the things that we've actually done and you can read about this the last couple of years, is that sometimes we've actually used topical sirolimus, which is very safe topically, where you put it on the skin, the liquid you put on the skin after laser treatment. And occasionally I've had patients who, for one reason or the other, weren't able to get laser treatment, and we treated them with topical sirolimus without laser, and they did have some lightening. So it's something that, number one, you want to discuss the possibility of restarting laser treatment. And secondly, you might also talk with your laser doctor, your physician, about the possibility of using some topical sirolimus, and that's something you could try, as I say, now, even without initiating laser, or using it after laser, because it may actually create an even better and more persistent response. So it's just something to think about.
Yeah, but this is also one of the reasons why, and this is nobody's fault, because this happened to a lot of people, Corinne, during COVID, that missed treatments, was that they saw the recanalization or the refilling because port wines were at the bottom of the barrel. I got one mom who had 8 treatments for her daughter, one every 3 months. The baby was 19 months old when COVID came. It was almost gone. And she said it looks like it did at birth, because she hasn't been able for 2 years to get any.
I mean, again, it may just be that you weren't. They didn't get as many treatments as necessary to really get rid of most of the lesion.
And who knows what the settings are? I mean, I'm the only one I'm familiar with in Israel that does the laser is Dr. Lapidov in Tel Aviv. But I know that Dr. Wayner's been going there every couple months, and he's looking into getting a laser and bringing it there with Dr. Farkas up in Jerusalem. So I'm not, sure about where you are or who was doing it, but it'd also be interesting to see the settings that were used. And again, you can write to Dr. Cohen, and he'll be happy to give you some feedback, just like we're doing right now. So it's heartbreaking, but this is why we say, and I know it gets controversial, but if a family decides they want the birthmark to be as cleared as possible, maximum clearance can be anywhere from 20 to 99%. You'll know she's at maximum clearance because the last 3 treatments saw no improvement from previous. So then it means either the settings are done or it just can't reach anymore. But with you saying it was like a glass of water filling back up, first I want to make sure it's a port wine stain.
I want to get a look. The images are going to be really important.
Right. Second, what were the intervals between the treatment and what were the settings? Because that's all can be the different factors. It can be so many different things.
Right.
Okay, Alicia Maria wants to know, what are the treatment options for residual redness or excess skin from, she didn't finish it, but I'm thinking maybe she means an infantile hemangioma, because that usually has some residual redness and excess skin.
Yeah, I mean,
so
again,
what are the options for that?
I mean, the residual redness, one of the options would be laser, and if it's a deeper component that respond to pulse dye laser, there are some lasers that get the deeper component. That's number one. Number two, if it's in a location where we expect there to be significant growth over the next 3 or 4 years, so like on the buttocks,
It's a hemangioma. She says she confirmed it is a hemangioma.
No, what I'm saying is that if
Yeah.
the hemangioma left a little bit of loose skin behind before one of the options is to get the surgical folks involved, but it may very well be, if it's in an area where there's going to be significant growth in the next 3, 4, 5 years, would be to hold off a little bit, because there may be just increased growth of normal structures that causes the skin to stretch out and for the residual loose skin to kind of disappear. So
Yeah,
again,
but you have to see, because you got to see the location. Is she going to be going in
exactly,
school?
the
There's
photographs
so
would
many-
be important.
Will she be in school? Is this a lesion that she's going to
If
be
it's a
bullied?
covered area,
Yeah.
there's no rush, because
Right.
her friends are not going to see it. If it's not a covered area, if it's not in an area that's going to grow significantly over the next half a decade, then it may be something that
And
surgical improvement.
without looking at the pictures too, I've seen some residuums that look like they'd respond to a CO2 or Fraxel laser.
That's what I'm saying. Is that
Yeah,
other
yeah,
lasers may be okay.
Depending on, like you said, how much redundant tissue is there. So again, you've got my email posted in the discussion here, and I see Dr. Cohen's. Oh, it is Dr. Lapidot. That's what I wondered. Okay. And so I'm sure you have his settings. Like, he's been the laser king there for like ever and ever. And also, is it near the eye and so forth. Okay, so we've got quite a few people on, and we've been, okay, so yeah, there's Dr. Cohen's email. For those of you who scroll up, and you can see his email, and you can see my email as well. And we are open for business for taking the next questions. We're caught up with these. And by the way, for those of you asking questions on the VBF website, Dr. Cohen is one of the authors on this booklet with me, Everything You Need to Know About Hemangiomas, and that's at birthmark.org. Click on the picture of the hemangioma, and you can read it. You can download it, or for your donation, you get a hard copy. We have this one also on port wine stains that I did with Dr. Nelson and Geronimus. Frequently Asked Questions, great book. And then the other one that we have done is the Sturge-Weber booklet, Frequently Asked Questions, and that was with Dr. Comey, who actually worked with Dr. Cohen for years. I'm in Baltimore, Maryland with him right now, where Hopkins is. Okay, I saw another question come in. For some reason, I can't see Dr. Linda's full email. Can you please write it again? VBF President, all one word, for V for vascular, B for birthmark, F for foundation, VBF President @gmail.com. So if you just can get that down, you can also go to birthmark.org, and it says Ask the Expert, and then you can see my picture and click on that. So Corinne wants to know, is 10 millimeter, 8 joule, 45 nanoseconds a strong setting for a port wine stain?
That is a strong setting.
It's a fairly good one.
It's a good setting, and the thing is it's a big size, right?
She
10
didn't-
millimeters, yeah.
10
millimeters,
millimeter spot
so-
size. He's probably got the perfecta.
Now that sounds pretty good, and that actually allows for a fairly quick procedure too, which is kind of nice.
Yep. Okay, so Carrie says her grandson has a port wine. He's 12 months old. He's going to Duke, and he's seen by Pete Ophthalmology in Charlotte, told not a hemangioma. His eyes were dilated and examined, It's on the side of his face, very close to his eye. Okay, so it's likely a port wine stain because they ruled out that it's not a hemangioma.
Got it,
And
yes.
if they're checking the eye, then it's likely.
It's important for them, it should be an ongoing issue in terms of getting eye examinations, at least on a regular, a couple times a year now maybe, and then at least once a year, maybe indefinitely, just because there may be some subtle vascular changes in the eye which may not cause problems now, but may cause some subtle changes over the next decade or two. It'd be nice to have, I'm sure that the ophthalmologist has gotten some imaging too to look and see how extensive it is and what parts of the eye are involved, whether it extends beyond the eye, beyond the orbit of the eye itself, into the parts of the nervous system that extend into the brain. But those would all be important things to follow.
Good advice. Okay, so I see more people are on, and we are able to take your questions. And again, Corrine, it could be, I mean, Dr. Labiduth will know whether this is a port wine or not, and it could just be your location. One of the things oh yeah, I have it right here, and I believe we have these on our website, but we can also mail them. It's a bookmark, but it's all about sun facts. Now,
yeah.
talk about that because she's in Israel, and
Yes.
I've been there, and I love that country, but it is hot.
There's plenty of sunlight, and the point is and actually my wife, Sherry, is working on a discussion for the VBF about sun protection. It's when the lesions are actually being treated with laser, it's very important to protect them from sun because they can tan, and the pigment from the tanning can interfere with treatment. The tanning itself or the exposure to sunlight can cause the area to heat up, and that may actually cause increase in the size of the vessels or more extensive lesions. So there's a lot of reasons that you want to use sunscreen. But again, it's just really important to protect it regardless. I'd say this is true for hemangiomas and vascular lesions of any sort because the sun can damage the skin, and it's not just visible light, which we want to protect our skin from. It's also the ultraviolet light, which gets a lot of bad press regarding the risk of developing skin cancers in other areas, but certainly this area too, and it can damage and increase the prominence of vascular lesions. But also, we discussed this earlier because someone asked about using a moisturizer on a port wine stain or vascular malformation. And my advice was, why don't you use a titanium dioxide or zinc oxide containing sunscreen, because not only do they generally provide good moisturization, but they provide, especially in the summer when it's important here in the U.S., but for you in Israel all year round, it's important. You might like to have a moisturizer, but also it's incredibly important to protect the skin, not just from ultraviolet light, but visible light, and all wavelengths of light that get through the atmosphere. They could get to the skin because they can all cause increasing prominence of the lesions and damage the skin and interfere with laser therapy.
So Carrie writes another question. Her and her husband are both also in the health field, and they were at Duke, but there was question, the hemangioma port wine, and then they did the imaging of the eye, and she said, yeah, it probably is suspicious for Serge Weber. So I think they should see Dr. Comey.
Well, they should see. There may be some. I don't know if there's someone down there at Duke. There may be somebody down at Duke. I think there is.
That does a ped neurologist.
It doesn't. Yeah, I would check with neurology down in Duke first because I think there may be somebody there who is involved with the Serge Weber Foundation or the Serge Weber group.
Yeah.
And they would actually what our group does here for lesions that are in the distribution where there may be an issue with Serge Weber in kids under a year of age, because the imaging can actually give false negative results. She actually gets EEGs and all these kids to look and see if anything is going on. And in kids over a year or two of age, routinely would get imaging too. Now again, if there's evidence on EEG that there's a vascular malformation involving brain or deeper structure of the eye, and this kid has Serge Weber, then certainly working with the the radiologist and if they have a Sturge-Weber group, there's a combination of things where you can look at EEG, mouth imaging studies, and also look at the neurology, look at possible interventions for management if the child is at risk because of the location of the malformation.
Also the eye exam, that's
And
very important.
the eye exam is incredibly important, and even if nothing is required for treatment now, a routine eye exam on a regular basis indefinitely is incredibly important, because there may not be any complications now, but over the next decade or next 3, 4, 5, 6 decades, there may be complications which develop subsequently.
All right, well, Barbara has an interesting question, and it's about using sunscreen if it can be used on a 1-year-old. And I found it very interesting on one of my Facebook Lives, where I think it was Dr. Duarte said you're not even supposed to take a baby out into the sun before 6 months.
Well, here's the thing: is that the FDA, the Food and Drug Administration here, recommends that you not use sunscreen in children under 6 months of age. And the reason they say that is because there's a potential for irritation. But even the non-therapeutic ingredients sometimes can be quite irritating. And in a child under 6 months of age, there's no reason the child is not going to be mobile. You don't have to worry about them running out in the sun and getting sun exposed. So they can be protected with clothing, with umbrellas, with physical things.
The sunscreen clothes, and
yeah.
But also they think it's only in the sun. It's not. It's daylight.
Well, yeah.
Because there can be UV.
Visible light can be an issue too.
Light.
So the point is that after 6 months of age, it's certainly reasonable to use the sunscreen. Again, until a kid is mobile, until a kid is walking and running, you can keep them in a stroller with the top on. You can keep them protected. You can, after 6 months of age, you could use the sunscreen. And certainly when they're mobile, it would be very important to use the sunscreen. If you're in a part of the world that has sunlight all year round, it becomes even more important to protect them with protective clothing and umbrellas and things of that sort. Once they become mobile, once they start to walk and run, then it's important to use clothing, even more so for them, use clothing and sunscreen. And right now, the only sunscreen that's considered to be GRACE, which would be generally recognized as safe and effective here by the FDA, is titanium dioxide and zinc oxide, which both of which are physical blockers and are very, very safe and relatively easy to use.
Okay. So Carrie, the one who wrote before, where Duke thought it was a hemangioma, but now it's a port wine, and it is in the Sturge-Weber area. She was never told by that VA team that it was possibly Sturge-Weber.
Well,
So
you know
now
what?
she
If it's
should
not,
get it investigated.
listen, I think you should see somebody in the if there's I think there's at Duke there is a collaborative vascular anomalies clinic.
There is.
And I'm sure there is, and you should see somebody there. But if there's any question about diagnosis? But the pediatric neurologists who deal with Sturge-Weber are pretty savvy as a group. So, and I think there is someone there at Duke. So you might want to just get scheduled with one of the pediatric neurologists who has a special focus on Sturge-Weber.
But you can do a consult with Dr. Comey. She's our expert from Hopkins, from the Kennedy Krager Institute for Sturge-Weber.
You certainly can. But
and
again,
she's very willing to do these
yes,
consults.
but she has collaborators down at Duke.
Yeah.
Yeah.
But I'm saying
In your neighborhood.
Who knows when they can get in? It's
Right.
Seems like
At the very least, you can
doing her
send. At the very
homework.
least, you can send pictures to Dr. Comey. She can take a look at them.
And Carrie's kind of doing her homework, so she can go back and say, if you guys say this isn't a hemangioma, the only thing it could be is a port wine stain. Well, with the location, why aren't we talking about Sturge-Weber or setting up testing on it? Maybe this is why.
If this child is under a year of age and has not had an
Yeah.
EEG, she deserves an EEG. If she's over a year of age, again, regardless, she should see the Sturge-Weber people there, the vascular anomalies people there, and I think they're right. Again, if she can't get access to them, she certainly can talk to Dr. Comey through the Vascular Growth Foundation.
So hi to my friend Barb from Alberta. She's with Remington Derm up in Alberta. We'll be seeing her. Chrissy St. Armour says, does having a venous malformation in your arm cause issues with getting blood drawn? We haven't ran into this, but it was something I was wondering out of curiosity. My daughter is 5 and has a VM on her arm.
Well, I probably would. I mean, listen, just to be on the safe side, I probably would draw the blood from the other arm.
Yeah,
I mean, it's
I was
it's a
thinking the same
no-brainer.
thing.
I mean, could you, if you had to, could you put an IV in there, or could you draw blood? The answer is yes. I mean, again, if it's not a complex venous malformation with a large component overlying the vessels there, but my response would be is that if you need to get a blood draw, get it from the uninvolved arm. And it's just straightforward, simple, easy.
Great. Our COO, Scott Couples, is on, and he's saying hi to me and you. Hi, Scott. Okay, so they're going back to Duke, she said. So, okay. So we now have Nicole on and Nazietzen. And, okay, let's see. Caught up with questions. Hi, Gerard Rogers. Again, Dr. Comey is here. How many years were you at Hopkins?
I trained there, and I was there, starting 1991.
Oh, wow. So many years.
A long time.
Yeah. And treating port wine stains.
Oh, but treating as a pediatric
you've been
dermatologist.
Yeah, but you've been one of the pioneers with laser. Like you and Roy Geronimus were pretty early with them.
Well, one of the things that we're actually working on a paper for the families and for the docs is on using topical anesthetics. One of the I think mistakes that people are doing, since the average length of treatment for these things is
45
less than
seconds.
It's less than a minute.
Yeah.
And so to take a kid to the operating room, put them to sleep under general anesthesia, especially if they're under 3 years of age, where the evidence tends to favor, shows that there is some risk to the central nervous system, to the brain development and other complications from general anesthesia, especially multiple procedures, over a period of a couple years in very young children. We've been a big advocate for going with topical anesthetics, things of that sort, which I think, if done properly, can be done painlessly or almost painlessly, that quick and they're easy. And there's, like I say, the longest procedure I've ever had was a child who took maybe 3 or 4 minutes. Most of it was like less than a minute, because it's very quick and easy to do that. And so taking a kid to the operating room, spending a half a day getting ready for it, going to the OR,
Starving them.
putting an IV in, which people always say, well, it's painless to do general anesthesia. I said, but listen, the time it takes to put the IV in,
and the trauma and all that,
and the trauma associated with that, and going to the pre-op room and all that, that can take a few hours, and it can be a few hours in recovery. It's
for
not
a 45-second procedure.
Oh my God! For a procedure, it takes 45 seconds. If you use a topical anesthetic properly, it can be really painless. And there are all sorts of one of the things we're talking about is that there are all sorts of distractions that you can do to keep kids entertained, so that that we keep them from being frightened by the prospects.
Okay. So Nicola King has a question. She has 2 daughters with port wine stains on their faces, and have been referred to neuro. Is this uncommon and genetic with both people? Well,
one of the things we were talking about earlier before this session now is that there may be a genetic predisposition, but many of these lesions are associated with what we call somatic mutations. That is, mutations that may occur late in pregnancy, or that are localized to small areas and not inherited. But I'm not going to say that none of them are inherited, because there is some evidence that there may be some increased risk of having a port wine stain when there's a parent with a port wine stain. But again, generally speaking, even though we recognize them as genetic, again, the changes that occur in the genes occur in a specific location, not related to the genes that are acquired from mom and dad.
Right. And see, Jessica, this is like exactly why I'm doing what I'm doing, Jessica Joe, with trying to get fair, equal, uniform access. She's in Oklahoma, and no one there will use an ocular shield on the child. So then all these places around the world that doesn't use the ocular shield, and it's absolutely necessary when lasering around the orbit.
Well, maybe the other thing too is that in the kids that have port wine stains in that area, where we use a topical anesthetic for the lesions that extend beyond. But there's actually a couple studies that you might find if you look online there, where they actually look to see if there was increased pain or anxiety in the kids who actually had to have an eye shield placed. And what the placement of an eye shield, it takes like 3 seconds. What you usually do is you put a little eye drop in that has an anesthetic in it. You wait maybe like 10, 15 seconds, and then you drop the eye shield in. And yes, it could be a little bit scary, but if it's done properly, it's totally painless.
Right, and she's saying she has to drive from Oklahoma to Dr. Friedman in Houston to get anybody to laser around the orbit. So, because he uses the eye shield, and I agree with you, Jess. It's
I wouldn't let
this-
somebody do it without the eye shield. That's a no.
yeah,
that's a no-brainer.
that's definite. No lasering around the eye without an eye shield, no matter how old they are.
Even if it doesn't, even if the port wine stain doesn't involve the eyelid, you're
Right.
close enough there that you can cause some trouble.
Yep. Okay, yes, thank you all very much for doing this work. You're welcome, Jess. Dr. Friedman is great. It takes him a few seconds to pop it in and out. No trauma. Yeah, I actually had Dr. Geronimus. I videoed him putting an eye shield in, and we posted it on our Facebook page a couple years ago. And I did it because I was hoping, because if we can't get the doctors to start using it, let's get the parents to start insisting that the doctors use it, or they'll go elsewhere. That's the only way you're going to get change. You just got to like kick your feet and dig your heels in and say, you know, I don't want retinal damage.
I mean, it should be part of the routine, to be honest
It
with you.
should be, but that's why we have a uniform guidelines laser committee to make sure this stuff does become uniform. Melanie just joins us. Debbie just joined us. Penny. So we are caught up with our questions, and we do have another 25 minutes, so please feel free. Those of you who don't know, if you go to birthmark.org, we have 3 free laser clinics this year, and in January we have one in Houston with Dr. Friedman. We have one next month. Well, the laser's all booked up, but we have the super clinic where you can get a diagnosis, treatment plan, ultrasound, dental, psychotherapy. That's October in California, birthmark.org, free lodging, everything's free. We just don't have any free laser left. But in November, we have free laser left in Boston, and you'll be there, and Dr. Geronimus and Dr.
We can discuss
Nelson.
the diagnosis based upon the
And
clinical
we're
findings.
we're also doing free laser at that thing with eye shields. And then we have another free laser clinic in December in Italy, and then January we're in Houston. So you can just keep going to birthmark.org, and they're right on our front page. Okay, did I miss any questions? Thank you for the posts that's coming from staff regarding the conference and clinic. You can see she's putting the links in. Thank you, Nicole. She's thanking us. Melanie is on. Debbie Hill is on. Hi, Deb. So once again, we have those free laser. We also do free ultrasound at most of these clinics. We're doing the free ultrasound in California, in Boston, and in Italy, but not in Houston. So, and that's because Dr. Clay is the one who does the ultrasound. And at the clinic, the free laser in Boston in November, because Dr. Coletti will be there, Dr. Weiner will be there, like a lot of doctors that are surgeons will be there, who are also laser experts, Dr. Brockovich from the MGH. So if you just need a diagnosis, even not laser, you can still come to that free clinic in November in Boston. So even if it's venous or lymphatic or AVM and it's not a candidate for laser, you can still come and get a free ultrasound and a free diagnosis. Dr. Coletti has a laptop size, it looks like a laptop iPad, ultrasound device that's programmed to determine if the lesion involves capillary, venous, lymphatic, or arterial vessels. So we can basically see the depth and the activity, and this is important because sometimes we see something that looks like a simple port wine, it doesn't respond at all, and then we find out that buried beneath that is an ABM. Those are the CM ABMs, and we
Right.
caught a couple of those at our clinic. So you don't want those lasered because you can disrupt the AVM.
The other thing too is that those lesions, especially if they're on the head and neck or head, they have some increased risk of associated abnormalities in the brain. So even in a kid who's been otherwise completely normal developmentally, if one of those lesions is present, then imaging the head becomes an important issue too. Different from Sturge-Weber, but in some ways, because of the possible association with neurologic complications in the brain, it becomes important. The imaging is your first step to making the diagnosis.
So Jess, I mean, your baby has a port wine. Dr. Friedman's lasering the baby, so baby probably doesn't even need the ultrasound. But sometimes there's a real puffiness, like a real swelling, and it looks like one side of the face is larger than the other with a port wine, or with a venous or lymphatic, a tongue, a lip, a cheek, ear involved. And the ultrasound will say if this is active disease. It actually helps you to know what management you need to pursue for that lesion, because no two of these are alike. And that's why we just started last year offering free ultrasound at most of our clinics. So, and it's basically wherever Dr. Coletti's going to be, because he brings the programmable. And we're trying to get other physicians trained in using that. There are a couple that do. You're welcome, Jessica. Again, we have at the October clinic next month in California, top docs from around the world, diagnostic clinic on Saturday. We still have free ultrasound, free dental, free orthodontics if anybody has gum involvement with their lesion. The lasers are all booked out. There's no spots left. And then we have the free psychotherapy and the diagnostic clinic. So you get to see Sturge-Weber experts, Klippel-Trenaunay experts, dermatologists, surgeons, radiologists, they'll all be there. Okay, can an AVM develop from not getting control over the port wine stain? No, they're two different entities.
Yeah, I mean, like I say, if you have an AVM, you can have an AVM under a port wine stain, but there are usually other clues to something else going on. There's going to be
the main clue is bleeding, because they either say they get bleeding out of the mouth, the nose, or something.
But also there's often some increased texture in the area. I mean, it's not always. I mean, rarely it's kind of subtle, and you need to have some of these other clues. But when you have an arteriovenous malformation, they usually take up a significant volume of the soft tissue and extend pretty deep, and so there may be clues that something's going on in addition to just the capillary malformation, the port wine stain on the surface of the skin.
Right, but her concern is not a concern, because a port wine, if you don't treat it for the rest of your life, can never become an AVM.
Correct. It
doesn't matter what you do, because there are people who've lived 70, 80, 90 years with a port wine, never had it treated. But there are stains, and that's what I'm going to call them, because Dr. Mim, who was our pathologist, he says the AVM stain is different than a capillary stain, even though they call them capillary. He doesn't believe it. He believes the stain itself has more high flow to it, and that that it's really all part of the AVM. And
well, he can also use specific markers to look at the vessels and look at the cells that line the vessels, and the cells in those vessels, maybe even though it may look like a port wine stain, it may have markers, histologic markers that are different, and allow for diagnosis of an arterial.
That'd be a good study to do too, is for all cutaneous AVM stains, take biopsies, especially if we look at the clinical pictures, and as a baby, if it just looked like a port wine.
Well, again, many of them get treated at some point, and so at the time a biopsy can be done.
True. Just checking the time, we're almost at 1:15. We did get on a little early, but that's okay. We promised you we would be on from 3 to 4. We got on a little early due to some technical issues. So let me think of what else. Also, anybody who's in the New Jersey, Pennsylvania area, we have an adorable wish list by AM Fashion Show to benefit VBF. Half the models have a vascular birthmark. The designer herself has an AVM. It's a fundraiser every year that benefits VBF, and it's a great time for everybody who just wants to celebrate and have some fun, and it's really adorable. And that's also on our website. You can see how to get a ticket to that. It's called Wishlist by AM, because that's Ashley Mortenson's the designer, and that's her logo name. So that's in November. So we've got a lot going on. So if you're interested in attending like a fundraiser VBF event, I will be there. And that is in November. So like I said, we have Super Clinic in October. November, we have the clinic in Boston. We have the fashion show in November. And then Italy is December 9th, and January is Houston. So, and I'm actually working on more and more free clinics around the world, as many as we can get, but within reason. My goal is that our top experts would have a VBF free laser day every year. They pick the day, and one Saturday or Sunday a year, they just do a VBF free laser day. That's my goal. That's what I want to strive for. And that it just becomes an automatic thing, that they just keep running it every year. Okay, so we can take more questions. We're at quarter of. We already answered that question. Okay, I want to make sure I didn't miss any. We're being reminded that there's no free laser in California. I know that. And there's Milan. So we're happy to take your questions. Again, our booklets are free to review on our website. If you want a hard copy for a donation, you can get one. This one's on Sturge Weber. It was done with Dr. Ann Comey and myself. There she is, right there. And then this one is the Port Wine Stain. And this was done with Dr. Nelson and Dr. Geronimus and myself. These are all the most frequently asked questions over the last 28 years. Feels like 30. And then this is the hemangioma one. Dr. Cohen's on that. Dr. Wayner, Dr. Duarte, and myself. So these are all available for you. Let me just see if I'm missing anything. Anything over scars on port wine stain from laser burns on babies would be helpful.
Well, the thing is this, is that you definitely want to use a sunscreen to protect it. If it's in an area that's covered, I mean, I think it buys you lots of time, because the scars, I'm not saying they're going to necessarily go away, but they often will get significantly better over time. If the scars are associated with abnormal color, increased redness, or increased pigment, those can actually be treated relatively easily with a laser. Again, it depends where it is and whether it's symptomatic or not, and again, the age of the patient, because very often the scars will improve significantly over time. If it's not getting better, then it's in a really important area, then looking at more laser options to improve it, or surgical removal becomes an issue.
Yeah, and you know what? I remember talking to you, Jess. I know I remember now, because I remember you being in Oklahoma, and then I told you to go to see Dr. Friedman because I thought he could fix this, the burns. But I want to see, can you send me some pictures? Because I want to see if he's done 11 treatments. I want to see what the progress is at this point, and then shoot her picture out to my closed group that I have of like 14 experts, and just say, what other options do we have here? Because the baby's already had 11 laser treatments to fix this burn scar.
Oh, okay, that's a lot.
So
of
she's
treatments.
it is a lot. So that's why I want to see. So yeah, send me those pictures, Jess, okay? Send me the first one that you sent me, which I have on my phone, but 100 and some new inquiries a week, I forget how to go back to the date. And then let me see where she's at right now, and get good close pictures, because I want to see the texture of her skin. Because there are also, the thing is, there are a couple specific people that I know who actually just do fix the scars from burns, and Stuart Nelson's one of them in California. So he's like trained in that to fix that. And they could be using different lasers or different settings. I don't know. I have to see the when you email me the picture, tell me what, he's probably using the Perfecta, unless he's using the CO2 or the Fraxel, which is what I would think he would use.
First class, yeah.
Yeah, so, but just let me know. Send me a note. Okay, so that's more information. You're welcome. Oops, almost lost my questions. Okay, so we are at 10 minutes to go, everybody. You got 10 more minutes to pick Dr. Cohen's brain. Our brains, our mutual brains, right? And hopefully the Basic Guidelines project will be done in another year or so, and hopefully we will see less of these adverse outcomes. And I think I may have even told you about that, Jess, that because of adverse outcomes, I proposed to the ASLMS to do a joint project with them to create uniform standards to prevent any of the burning, scarring, ulcerating, hypopigmenting, hyperpigmenting. Many things can happen. So we need some uniform guidelines and standards. And I've been working with, like 16 laser experts in the group, trying to get consensus. And Dr. Cohen's been working on anesthesia options. His wife, who's a nurse practitioner who's been in the field for as long as he has, is also working on how to keep port wine stained skin healthy, different things that you can do with it. So once we get some of the things that we can share, we'll be able to share them with you. Okay, so let's see. We are 10 minutes out. It is 3:50. It is a beautiful day in Baltimore, Maryland. People are outside
Not
having
too
a good
hot,
time.
the sun is shining.
No, it's beautiful.
Good shade.
Everybody's saying, get ready for the fall. I'm like, it seems to me like this has been the longest warm spell we've had in a long time. Because we had, I'm in
A couple weeks ago.
Yeah, I'm in the
It hasn't been, the last
Albany,
week has
New
been
York,
kind of
yeah.
nice.
Albany, New York area where
Cold
I'm
weather's
from.
coming next
Yeah.
week.
Yeah, is it?
Cool weather,
Oh,
yes.
cool. It's all right.
yeah.
I love this time of year. Okay, and once again, another document that we have, which is important, is It's a Birthmark card. We make this available to you. We have a JPEG of it, which you can carry on your phone, and Dr. Cohen worked on this with me, with Dr. Geronimus. And parents carry this on their phone or with them for when they travel, because a lot of times kids with purpura from laser or having malformations or hemangiomas, the parents get accused of child abuse. And so we have them carry this. It's a vascular birthmark. It explains what it is and shows every kind of picture from various examples so that people can say, oh, okay, that's what a birthmark is. So we feel that this is a very important resource, and as I said, we have it as a JPEG so that you could keep it on your phone as a photo if you wanted to show it to someone. Oh, I'm sorry, Karen. Let me scroll back and see. What was your last question? Let me see. Daughter has, she has some puffiness, volume to the port wine stained side of her face. It is not severe, and she didn't seem to have it when she was younger. Do you think there can be something other than that? We were treated by Weiner, Berenstein, Geronimus, Lapidot. No one mentioned AVM, but now she has some thickening asymmetry, also has severe eczema. Well, there is a port wine stain with overgrowth. So that's not an AVM, but
you can certainly have some overgrowth of the underlying soft tissue,
yeah.
even with an otherwise completely innocent port wine stain. I mean, if it's significant,
and these guys are the top.
It certainly may be worth getting.
Geronimus.
It may be something that you could get a quick ultrasound and just look and see and make sure there's nothing else brewing there. Probably nothing else going on. Probably just normal, natural phenomena associated with the port wine stain, but not unreasonable to get an ultrasound.
Right, and again, there's a subgroup, and Dr. Wayner's actually doing research on this right now. There's a subgroup of port wine stains that have tissue overgrowth, and it favors the lip. we see a lot of overgrown lips with port wine, but it can also be the cheek.
It can be any some of
Yeah,
those concerns.
I actually have a patient that has her upper eyelid up to her eyebrow is all overgrowth, so that they're not symmetrical. It's not a flat red one. It's a port wine with some puffiness. You know, you can get an ultrasound to rule it out, but like you say, you've seen Berenstein, Geronimus, Lapida, Weiner, top. So they're really top guys. And the severe eczema, so that you can talk
Well,
about.
I can talk to you about that.
Yeah.
There is some evidence that it's interesting. And again, you could, if you just go to Google and put Google, is eczema worse overlying a port wine stain? I think you'll find there's actually a good bit of literature now showing that in kids with port wine stains and eczema, the eczema does have a tendency to flare more and to be more of a problem over the port wine stain. And it probably just has something to do with the fact that those capillaries, those vessels that are increased within the port wine stain, just like any other normal capillaries and other sites, contain inflammatory mediators, things which drive your eczema. And when your eczema flares, it isn't unusual for places where you have increased vascularity, like in a port wine stain, where the eczema is worse. So that's something that's been reported to be a very common phenomena. And so even when the skin there is clear, I always ask people to be very aggressive about using moisturizers to protect it from irritants and things that might make the eczema flare. And if they're using topical medications to treat the eczema, I always suggest that they watch these areas very carefully, because these may be the first areas to flare when there's going to be an eczema flare all over. They may be the last areas to get better and resolve when they're using a topical medication to treat the eczema. So again, it's just something to be aware of and to watch carefully, and again to protect, even when the eczema is totally going everywhere, including where the port wine stain is. I always tell people that if you stop using moisturizer in other places because it doesn't seem to be a problem, I would use a moisturizer overlying that port wine stain forever, because it's the first place in some of those kids where the eczema will tend to flare.
Okay, thank you. So Mickey's question and Karen's another question are very similar, and what I want to say is, just before our original medical director, Dr. Mim, my hero, my mentor, passed this past July, we had actually met with Dr. Weiner and his team looking at these phenomenon of these port wine stain that have overgrowth, and Dr. Mim was seeing some different markers. So there's some port wines that just stay flat, but there's some port wines, and they are a port wine plus. They have overgrowth, whether it's the lip, the cheek, or whatever. And it doesn't matter about laser, because that's the next question. If you lighten the port wine with laser, will you prevent overgrowth? And the answer is no. Dr. Geronimus addressed this and said, it's a different marker that makes the overgrowth.
So there may be, at least we know of at least two. In fact, we, working with the George Weber group at Kennedy Krieger at Hopkins, and the genetics folks there, we identified two genetic markers associated with port wine stains. But there probably are additional genetic markers, and some of those genetic markers may be associated with overgrowth where others may not.
That's what Dr. Mim was seeing, yes, that he was finding, but he passed before it could get published. But Dr. Weiner is going to publish it with, I believe, his team from Israel. And I know he's going to be going there before the end of the year. So those of you like Karine that are on from Israel, he'll be there. He'll be up in Jerusalem with Dr. Farkas, because they have a new clinic up there. Well, we have 2 minutes left and change, and I hope that all of your questions have been answered. I appreciate the time that you've taken. We've had a busy day today. We did a recording of a video that VBF will be distributing soon, where we spent over an hour discussing what every new parent should know that has a child newly diagnosed with any one of our 9 primary vascular birthmark types. So a lot of what we talked about this morning became like a refresher, right? For what we were saying today. So all the things we discussed of what parents need to look for. And I will say, and the takeaway is, everybody gets more, and this for all you port wine, all you AVM, all you VM, all you birthmark people. It doesn't matter if it's the summer. You need that sunscreen all year, no matter what time it is, daylight. And also, I know Dr. Cohen's wife's talked about this, and Dr. Cohen, about not going in the sun at all before laser.
Oh yeah, there's no question that going to the sun before laser, it might trigger increased pigmentation, which can interfere with laser. It might cause a superficial burn, which can increase redness and increase the vasculature to that area temporarily. It can also damage the skin. I mean, more than just the things we talked about. So it's clearly recommended that you stay out of the sun before, on the day of, and after laser treatment. I mean, I would just say, or be very, very aggressive about using titanium dioxide, zinc oxide physical blockers. In fact, we were talking about this earlier. There's some of the inactive ingredients actually protect from some of the other light. I think there's iron oxide is often included as a quote unquote inactive ingredient, and in fact, iron oxide can protect against visible lights, which can also cause damage to the skin. And again, that's an issue, particularly an issue before the day of and after laser treatment, but is a long-term issue to protect the skin. I mean, I think everyone should do it, but if you have a port wine stain, damage to the skin from sunlight is exaggerated because of the increased vasculature to the area there.
Thank you. Well, that wraps it up for this month's VBF Facebook Live. Next month, I will be live from California with Dr. Stuart Nelson. And then in November, I will be with Dr. Comey doing our annual Sturge Weber Facebook Live. And in December, I will be with Dr. Coletti going live. So thank you all. And if you have any additional questions, feel free to email me or
send it to the boss, and then she'll get me involved. That was probably the safest way to do it.
Best training ever. He knows who the boss is. Thank you all. Stay safe and stay healthy. See you next month.